In floor of cranial cavity, we have reached to middle and posterior cranial fossa. We are going to see the features in foramina here. Anterior cranial fossa and interior of the vault has been covered in previous video. So the middle cranial fossa, basically its shape resembles like a butterfly, and two bones which are forming it is body and greater wing of sphenoid, and along with the anterior surface of the petrous temporal bone. It has not been written here. So along with the anterior surface of the petrous temporal bone, and this middle cranial fossa is basically lodging the hypophysis cerebri in the middle and the temporal lobes of the brain on each side. So this is the demarcating line which we have discussed earlier. It is separating it from the anterior cranial fossa, and posteriorly from posterior cranial fossa you can see, if we draw a line on the superior border of the petrous temporal bone, the dorsum cellae, and on this side also the superior border of the petrous temporal bone. So that's how we separate this butterfly shaped middle cranial fossa from anterior and posterior cranial fossa. If we see the features in the middle cranial fossa, here is the middle part or midline part, and this is the lateral part. So what are the bones which are forming it? We have seen like this was the greater wing of sphenoid area, in which you can see foramen rotundum, which is not very clearly seen here, foramen rotundum, and the foramen ovale, the foramen spinosum, and this portion is basically the squamous part of temporal bone, and this is the petrous temporal bone, and we are seeing the anterior surface of the petrous temporal bone is a part of middle cranial fossa. Now if we see the features in midline, so first is the sulcus chiasmaticus. Then you will see this is tuberculum sella. So this tuberculum sella is basically posterior border of sulcus chiasmaticus. You have seen the anterior border or the anterior margin was included in this demarcation, which was separating it from which was separating the anterior and middle cranial fossa. So this is the sulcus chiasmaticus, and the posterior margin of the sulcus chiasmaticus is tuberculum sella. On either side of the tuberculum sella you will see these are the middle clinoid processes, this and this. Now if we move posteriorly, we will see this fossa. This is known as hypophyseal fossa, and this vertical plate which is lying posterior to the hypophyseal fossa is known as dorsum cellae, and these two lateral ends of the dorsum cellae are forming the posterior clinoid process. These are the projections on, this is one posterior clinoid process and this is another posterior clinoid process. So you see these three things like the tuberculum cellae, the hypophyseal fossa, and the dorsum cellae. These are forming dorsum cellae are forming the sella turcica. Okay, so this is sella turcica. On either side you will see it will be lodging the cavernous sinus. Now there is one foramen which is seen here between the body and lesser wing. This is optic canal, and one more foramen which is not very clearly seen here is between the lesser and the greater wing of sphenoid. That will be your superior orbital fissure. Okay, so we will see like the bones forming middle cranial fossa. We have seen the squamous part of the temporal bone, it's seen on lateral aspect, and the petrous part if we'll see, it was seen here. So this is the anterior surface of the petrous part which was forming the middle cranial fossa. Now if we'll see the petrous temporal bone in a section, so the petrous temporal bone is lodging labyrinth of internal ear, mucus lined air-filled spaces of middle ear, mastoid antrum, bony part of auditory tube, and it is traversed by internal carotid artery. So you can see this is the area of tegmen tympani. So what is tegmen tympani? If you'll see, this is the anterior surface of the petrous temporal bone, and here you will see the arcuate eminence, and anterior to arcuate eminence this area is tegmen tympani, and this tegmen tympani is basically forming a roof of the tympanic cavity. Here you will see, and this here you can see meatus temporal bone. This whole is the meatus temporal bone, which is lodging the labyrinth of internal ear, the middle ear, and the mastoid antrum, and the bony part. This is the bony part of, this is cartilaginous part. You will see this is the bony part of eustachian tube, and internal carotid artery will traverse it. So that's how we move to the other slide. Before that, we will see this in middle cranial fossa, the temporal lobe is being lodged. Here you see the frontal lobe of the brain was being lodged. Here the temporal lobe on either side, the temporal lobe will be present here. Now, in midline features, we have seen the sulcus chiasmaticus, and optic canals we have seen, the sella turcica we have seen, and carotid groove on either side. Basically, the area where I was telling you the cavernous sinus, here the cavernous sinus was present, and this area is grooved because within the cavernous sinus you will see the internal carotid artery will pass. So there is a groove formed that is known as carotid sulcus or groove. Now in lateral parts you will see 4 foramina of greater wing of sphenoid, groove for middle meningeal vessels, foramen lacerum, and meatus temporal bones anterior part, which will be showing different features I am going to discuss. So midline we have seen once again the tuberculum sella, the hypophysis fossa, the dorsum sella, and this is the sulcus chiasmaticus. Here the carotid groove or the area for cavernous sinus. Laterally we move, we get to see, okay, so this is sella turcica. The sella turcica, if you want to understand once more, this is the area of hypophyseal fossa. If we imagine, this is the tuberculum sella and this is the area of the dorsum sella. And so this is a Turkish saddle. Now foramina which we were talking about in greater wings are the foramen rotundum, the foramen ovale, the foramen spinosum. So here you can see this is the greater wing which is forming the lateral part of the middle cranial fossa, and this is the foramen rotundum, the foramen ovale, and the foramen spinosum. Now you see between the lesser wing and the greater wing there is slit like opening or the fissure. This is leading towards the orbit. So this is superior orbital fissure. Now we are only talking about 4 foramina in a greater wing of sphenoid, but they can be presence of foramen of vitellius and canaliculus in nominatus. So that is not much significance. That is not of much significance here. Now we are coming to these. The greater wing we have seen. In greater wing we have seen the foramina. So here ovale and spinosum are seen. Now this is the anterior surface of the meatus temporal bone. And near the apex, just behind the foramen lacerum, you will see this grooved area that is known as the groove for trigeminal ganglion. Then when we will move posteriorly, you will see this eminence, that is arcuate eminence, which is formed by superior semicircular canal. Just lateral to this groove for a trigeminal ganglion, you will see there are 2 hiatus. This is hiatus for greater petrosal nerve, which is leading towards foramen lacerum, and more laterally if you will see there is this very narrow and slit like very shallow hiatus, that is the hiatus or groove for lesser petrosal nerve, which is seen moving towards the foramen ovale. So these are 2 important features here. So you see the groove for trigeminal ganglion, then you move to the arcuate eminence, and here anterior to the arcuate eminence, this area is tegment tympani. So this is anterior aspect where most commonly fractured in middle cranial fossa. This area, this is tegment tympani, which is forming the roof of the middle ear cavity. Now we will see one by one the foraminas which are present in middle cranial fossa and the structures passing through. This is the optic canal which was formed between the lesser wing and the body of the sphenoid, and you will see this is optic nerve passing through to reach the eyeball, and this is ophthalmic artery, which is a branch of internal carotid artery, and here it is lying inferolateral to optic nerves, and the internal ophthalmic artery will be also carrying sympathetic plexus around it, and optic nerve will be covered by meninges. Now the other foramen which we have talked about, between overhanging lesser wing and the greater wing, there was a foramina. This is superior orbital fissure, and if we see from the front, this is medial side, this is lateral side, this is right side orbit, and this is superior orbital fissure, this medially lying the optic canal. Now if we see, yes, if we imagine here, what are the structures coming to orbit through this fissure? So this is superior orbital fissure as whole. Now what is this green ring? This green ring is basically a very important structure, and which is surrounding the optic canal medially and attaching to like a tubercle here, tubercle of Jinn. So it is dividing the superior orbital fissure. This ring is dividing superior orbital fissure into 3 parts, and here you can see in anterior part what is lying in like this common tendinous ring is dividing superior orbital fissure into 3 parts, and superior and inferior division of the oculomotor nerves are passing here. So in middle part, superior and inferior division of oculomotor nerve, you will see the nasociliary nerve, and lateral to nasociliary is abducent nerve passing. So 3 and 6 in middle part, and now you will see the lacrimal and recurrent branch of lacrimal artery are also passing, and laterally, and superior ophthalmic vein and the lacrimal frontal and trochlear nerves are passing. So lacrimal frontal are branches of ophthalmic division. So if you see, this is the trigeminal ganglion, and it is giving 3 major roots. This is the ophthalmic division, this is the maxillary nerve, and this is the mandibular nerve passing through foramen ovale. The maxillary nerve is passing through foramen rotundum. It will come to the pterygopalatine fossa and will reach to the upper jaw to supply it. Now you will see the frontal lacrimal are passing, lacrimal frontal and 4th cranial nerve will be passing through superior orbital fissure, and nasociliary is also passing in middle compartment, and you will see inferiorly there is inferior ophthalmic vein. So this is very important, and optic canal is also shown here, and the medially optic nerve is passing, and inferolaterally ophthalmic artery is passing. Now foramen rotundum, as we have seen, this is the area of foramen rotundum. The maxillary nerve and emissary veins are passing through foramen rotundum. The tegmen tympani we already have seen. This is the tegmen tympani, which is forming the roof of the middle ear. And fracture of middle cranial fossa is very common because there are so many foraminas and canals present in it, and the tegmen tympani fractures very commonly happen, and bleeding and discharge of CSF will pass through the ear. And if 7th and 8th cranial nerve also involved, because petrous temporal bone, when it is being fractured, it may involve 7th and 8th cranial nerve also. So then if internal acoustic meatus is being involved, then these 2 nerves will also get damaged, and vitiligo will happen in the cases of middle cranial fossa fracture if semicircular canal is also damaged. So I have not talked about the foramen ovale and foramen spinosum, foramen lacerum, because these we have covered already in norma bassalis. Okay, so for revision purpose we can here include it that what are the structures passing through foramen ovale. So this is your foramen ovale, the mandibular nerve, the accessory meningeal artery, the lesser petrosal nerve, emissary vein passing through it. Where is your foramen spinosum? This is foramen spinosum, the middle meningeal artery, nervus spinosum is passing. This is foramen lacerum. You can see the meningeal branch of ascending pharyngeal artery. The emissary veins from cavernous sinus to pharyngeal venous plexus are passing through and through, and internal carotid artery with its sympathetic plexus and venous plexus around it is traversing here. And the gateropetrosal nerve enters from posterolateral aspect and leaves anteriorly to pterygoid canal, nerve to pterygoid canal. Now, so we are moving to the posterior cranial fossa now. So what will happen, like if there is a fracture in anterior cranial fossa, what will happen in anterior cranial fossa fractures? It is going to lead into CSF and blood leakage from the nose, because it is forming the anterior cranial fossa was forming the roof of the nose. Okay, so don't get deviated. So you can identify this is superior orbital fissure, this is foramen rotundum, this is foramen ovale, this is foramen spinosum, this is foramen lacerum, sella turcica, this is hypophyseal fossa, the tuberculum sellae, the optic canal, the dorsum sellae. Now in which the foramen, this is foramen ovale, this is foramen spinosum. Just for revision purpose, this is foramen spinosum and foramen lacerum. Now in posterior cranial fossa, you will see the clivus. In midline, the clivus, the foramen magnum, the squamous part of occipital bone, and internal occipital protuberance and crest, transverse sulcus, cerebellar fossa, hypophyseal and posterior condyle canal, internal acoustic, internal auditory meatus, and jugular foramen. So this is the clivus. So clivus is the sloping surface in front of the foramen magnum. So it is formed by the fusion of posterior part of the body of the sphenoid, including the dorsum sellae with the basilar part of the occipital bone or basi-occiput. It is related to the basilar plexus of vein and supports the pons and medulla. So here this is the clivus. Now foramen magnum. Now we will see the internal occipital protuberance, internal acoustic crest, and it is expanding here. So you can see transverse sulcus. Yes, this is the transverse sulcus, this is sigmoid sulcus, and between the posterior surface, this is the superior border of the petrous temporal bone, this posterior surface is coming in posterior cranial fossa. Between the petrous and the occiput bone, this is petro-occipital fissure, and the lateral part is basically forming the jugular foramen. Here you will see on posterior aspect this very important foramen, that is internal auditory foramen. And this area, this very like deep depression is lodging the cerebellum. Here the occipital lobe will be lodged above the transverse sulcus. And we already have seen what passes through jugular foramen. We already have seen what passes through the anterior condylar canal, which is not seen here. Here will be the anterior condylar canal or the hypoglossal canal. The hypoglossal nerve will be passing through. And yes, I think jugular foramen, everything we have discussed. So only important thing which is not taught earlier was the internal auditory meatus, which gives passage to the 7th cranial nerve, 8th cranial nerve, nervus intermedius, and labyrinth vessels. You can see this is the cross section. This is a section in which you can see the internal features of the petrous temporal bone, where the labyrinth of internal ear is found here. This is the middle ear, and this is internal auditory meatus through with the 7th and 8th cranial nerves, along with the nervus intermedius and labyrinthus vessel, which are not shown here, are entering inside the petrous temporal bone. Jugular foramen, I don't think we need to discuss it, but you can see it has been divided into anterior part. So this inferior petrosal sinus, 9th, 10th and 11th cranial nerves are passing here, and basically internal jugular vein and occipital artery with branches, meningeal branch of occipital artery are passing here. This is foramen magnum, divided into anterior narrow and posterior broad part, and we already have discussed, and this is the area where ligaments pass, apical ligament, cruciform and membrana tectaria. This is the lower part of the medulla oblongata, covered by the pia mater, arachnoid mater, and dura mater. In subarachnoid space, you will see there are vertebral arteries, spinal accessory nerve, and anterior spinal arteries and veins are also shown, but not in this picture. So this is the dura mater here, and with this I end this class, and we have almost covered everything. Hypoglossal canal earlier we have seen in norma basalis, that's why I'm not going to discuss it here. Thanks for watching.